Okay, today's topic is about spinal cord compression. Spinal cord compression can occur anywhere along the spinal cord. The most common two locations that are asked in the exam and also frequently seen in patients are the ones in the cervical region and in the lumbar region. Today specifically we will talk about the cervical spinal cord compression. Of course, there are many causes for the spinal cord compression, but the most common ones that are asked in the exams are related to bone disease or bone degeneration. So look for somebody who's having osteoarthritis and other signs of bone diseases. For example, if the patient has bony outgrowth somewhere else. So here is a picture. As we can see, there is bony outgrowth here, degeneration, and then rebuilding of bone in a misshaped way that will compress both the spinal cord and usually compress also the nerve root. For the exam, if you are rushing and don't have time, if you see a patient who comes with upper motor neuron lesion plus lower motor neuron plus a sign which is called hermit sign, then that's definitely spinal cord compression. What do I mean by upper motor neuron lesion? So you see this spinal cord, if it's compressed, then it will compress the spinal descending tract that carries motor fibers. And so the patient will present with upper motor neuron lesion below the level of compression, and that's usually the legs. However, at the level of the compression, we have lower motor neuron lesion signs. Why is that? Is because we have cervical radiculopathy, because the nerve root is affected here. And here we are talking about upper limb. And then the sign, what is hermit sign, is when you ask the patient to flex their neck. So flexion will cause more compression on the spinal cord, and the patient will feel like a sudden shock, electrical shock sensation that will go down the patient's back. So anytime you see these three signs together in the exam, then that's definitely spinal cord compression. One last thing, which is also important for the exam, as a lot of people confuse spinal cord compression with AML, is because AML also presents with upper motor neuron lesion signs plus lower motor neuron lesion signs. So how do I differentiate? In AML, it's the nerves that are being affected. It's neurodegeneration. It has nothing to do with compression. So the patient will not present with neck pain or bone pain. That's one thing. So only pure upper motor and lower motor without any pain. And the other thing which is usually mentioned in the exam to differentiate the two is hermit sign. So anytime you see hermit sign, is definitely spinal cord compression. So even if you ask the patient to flex their neck in AML, there will be no electric shock sensation because there is no bone degeneration in AML. Okay, that was the end of the video. Thank you.